Well, I'm from the state health department, and Renee is from a local health department, and we've worked together quite a bit through our respective systems. But the Robert Wood Johnson Foundation funding to create a practice-based research network was really an opportunity to sort of formalize a relationship and create a new structure for doing practice-based research.
I think one of the strengths that Minnesota has in its public health systems is the strong partnership that we have with the Minnesota Department of Health and the local health departments. So as this opportunity became available, they requested individuals who were interested, and certainly this is an area of interest for me. So I was able to participate really from the ground up and through the local public health association. So I really appreciated the opportunity to partner and to be able to, bring my perspective as a local health director, but also learn about research and how that impacts the practice for us. Well, from my perspective, I have a place where I can come and say these are things that I'm interested in learning more about, or things that I know that our system is struggling with, and it's an area where we can sort of vet that and then talk about how can we look at research that could maybe further along that particular issue. Gives us resources that we need in order for us to make some policy decisions, program decisions. Even how we just look at issues differently based on information that we've been given as part of the activities that we're doing.
Well, one example, our initial project really evolved from the work that a statewide Community Health Advisory Committee was doing in our state. We have a statewide committee comprised of local elected officials and local health directors that meets quarterly to make recommendations to the State Commissioner of Health. And a work group had convened of that broader body to really look at the public health departments in Minnesota and make recommendations on really how to strengthen the infrastructure, the system. And a key interest within Minnesota right now is the organization and structure of local health departments. And so our initial project was really to bring to that work group some descriptive information about our structures and changes that our system was undergoing and the authority of local health directors in different structures. And so we were able to do a descriptive survey, really work together to develop an understanding of what public health authority could mean, and to develop a survey to try and understand those authorities, and then bring that information to this advisory committee so that they could consider that data in the recommendations that they ultimately made.
So as a result, one of the expectations of a work group from the State Community Health Services Advisory Committee is some kind of a report back to the full group. So in the report back to the full group, one of the items that a lot of the data helped us put together was a guide that actually a lot of local health departments were requesting, that as you look at your structure, whether it's a change is coming, a change has happened, or you're just looking at, are we still doing what we need to be doing? A guide was actually put together with a set of questions that could look at some of these authority pieces around, do you have direct access to your board, or how do you make sure that you have direct access to your board? Do you have the ability to influence the budget for your department? And if not, how do you, how can your structure help facilitate that, whether you're, currently in a structure or a structure's being developed? And actually that guide has been used by a couple different agencies as they've now looked at different structural changes and or governance changes that have occurred. So the part of the research helped sort of develop and put together what the guide would potentially look like, and is a valuable resource for us in public health at the local level.
So we were, when we were analyzing the data, we didn't want to be in a position to recommend a certain structure over another structure, but rather to say, if certain structures might lend themselves to situations where health directors have more or less authority. Here's a guide, here are some questions to help you think about how to organize your health department so your health director has access to elected officials, opportunities to initiate agenda items before your county board.
Impact your budget, or influence the budget for your department, those kinds of things.
Because we believe that those kinds of authorities are important for Tier 3 public health competencies, achieving the national standards.
Being able to move quality improvement, measurements forward, impacting your performance over time.
It's only our initial study. Yeah, we've done additional work on local public health financing. We've done work on quality improvement and measuring QI culture, both within the state health department and in health departments across the state. So we already have other projects underway and planned. I think we'll continue to see opportunities to do practice-based research in the state. It's such a natural connection because the Office of Performance Improvement, where I am within the Minnesota Department of Health, routinely works with these SHAC work groups, which is really the I don't know if you could call it a policy-making body, Renee,
but I
mean, and then that group is just really key to our whole public health structure. And in the strategic plan of SHAC is becoming more informed and intentional about using public health research. So, I mean, we don't always know what's, way down the road, but I think this structure is, we're going to sustain this work. It really fits with, it's taken our relationships, I think, to a new level for practice-based research in Minnesota.
Yeah.